10 to 15 degrees. If, as an example, I'm going to take this board and turn it quickly. I'm sorry. Okay. I want you to lean forwards, bend your arm 90 degrees. Go lean forwards, lean forwards. Okay, down. So let's say if you did this with the arm bent, and then you did your ulnar deviation, now you would need to take this tube, careful, sorry, try not to hit anyone in the face, and you have to angle it this way, right towards the elbow. Right? However you would like to do it, whether straight arm or bent arm, you're angling the tube towards that elbow. Personally, I think straight arm is easier. For most patients, I think it is more comfortable. So we're going to go to straight arm method. So relax your hand. So 10 to 15 degrees. So for this one, I'm just going to leave this at 10. Make sure that you do recenter, because anytime you angle, your centering is going to now change. Okay, just going to open this up. Okay, nice and centered. You can put your hand down, slide back towards you slightly. Good. Okay, so let's see. Actually, since I drew the hand like this, it might be better if we demonstrate it with the left hand. Scoot your chair over this way, please. Alright, good. Just so that you can get the arm nice and straight. I'm just going to bring this across. Good. Okay, slide back. Good. So, as you can see on this picture, we are aiming for the scaphoid that's going to be right here. Okay, so we're going to center on the scaphoids. Slightly. Okay. If you look in the book, it also says that you can look for that styloid process. So if you feel the thumb side of your forearm, okay, just feel this all the way up. You'll feel this bump right here before you get to the wrist. Go ahead and feel for that. Okay, do you feel that bump right there? Right before you get to the wrist. You're coming up the arm, and there's a bump right there. That is your radial styloid process. From that bump, you can go 3/4 of an inch medial and 3/4 of an inch distal to find the scaphoid. Okay, that's very specific. You can try and do it like that. That is going to be absolutely textbook. I'll be very proud of you if you did. But I mean, for most purposes, you can just say, okay, so this is going to be the wrist. I'm just going to come in at a small angle this way. Okay. So right there, kind of near, more. Right, so here's that first metacarpal. I'm just going to be a little bit distal to that. Okay. But if you can do that 3/4 of an inch calculation, that would be really awesome. Okay, so from here, I'm going to make sure that this arm stays still, and now we're going to twist as much as possible. Okay, very good. Okay, so there's that styloid. Okay, we're going to be centering there. Okay. You do not need the entire wrist. Okay, so you do not need to worry about bringing your light all the way out here. Remember, our main focus is the scaphoid, right inside there. Okay. Which marker are we going to use?
Left.
The left.
Very good. This time it's the left marker. How is it going to be placed?
Here.
PA, and on which side? Thumb side. Okay. So that's going to be our left marker for the ulnar deviation wrist. All right.